Hi, my name is McCarthy Coyle, and you're watching Saving Lives, the battle here at home. And this is the second in a continuing series of programs about the AIDS epidemic nationally and what we're doing here in Missoula and in the state of Montana to save lives. The series is sponsored by the Vet Center of Missoula. We have three guests tonight. They'll introduce themselves more fully in just a moment. But our guests are Richard Johnson over here, who's the director of the Vet Center here in Missoula. Alette Wright, who wears many hats, but she works with Planned Parenthood as an educator. And Dr. George Reese from Missoula, who is an infectious diseases specialist. Why should the Vet Center be concerned? Well, Richard Johnson will tell us a little bit more about that, but just before he does, let's just, and I should remind you that this is a live call-in show, but we're going to get our conversation started for about 25 minutes, and then we'll be opening the phone lines to your calls and questions. Let's just put a little bit of reality on it. These are figures in Montana as of September 30th of this year. Since 1985, as of this year, September the 30th, Montana's had a total of 137 AIDS cases. Out of that, there have been 95 deaths, including 2 deaths of pediatric patients. 2 teenagers have died of AIDS. 37 Montanans between the ages of 20 and 29 are dead. The largest number of deaths, 59, come in the age group of 30 to 39 years of age. 26 deaths between the ages of 40 to 49, and 11 deaths of Montanans over the age of 49. 13% of this total were infected through IV drug use. Now that comes as a surprise to me because I live in Montana and I don't think of us as being a place where IV drug abuse happens. But there you go, 13% infected through IV drug use. 5% of our cases were infectious contacts between heterosexuals. 59% of our cases did arise from infectious contact amongst men having sexual contact with one another. 4% of the AIDS mortalities in Montana are found among hemophiliacs, and there were also 4 AIDS mortalities from other blood product transfusions prior to 1985. So those perhaps gives us a little dose of reality. And with that, I'd like to shift over to Richard Johnson of the Vet Center. And can you tell us what your job is, what the Vet Center is, and why you're even taking the trouble to invest your time and money in this series and other things?
I'm the team leader of the Vet Center, which is a team of 4 people, including myself. We're officially called the Readjustment Counseling Service of the Veterans Administration. As such, we are an outpatient treatment center, counseling center for veterans, primarily from Vietnam era forward. However, we provide services to any veteran or their significant others that come into our services. We primarily provide therapeutic counseling services. However, we are also involved with veterans in any aspect of health care. They have concerns about their health. We assist them directly or put them in contact with our medical resources. As a community-based program, we are concerned with anything that might have something to do with the health and care of veterans in our community. Western Montana and Missoula have a very high population of veterans, and so any disease or any problem in the community that would affect anybody at large is going to ultimately affect veterans and their families. In fact, the Veterans Administration, as the world's largest healthcare provider, has treated to date more AIDS patients than any other single health organization in the world. And so the Veterans Administration has been actively and still is involved in research and treatment of AIDS. And as a community matter, we're concerned.
Mm-hmm. And before we go on to Alette, so if I hear you right, any AIDS or worries about AIDS, or it comes under your purview, a vet can come in and see you folks at the center and talk things over confidentially.
If any veteran or their family is HIV positive or has AIDS or has concerns about that possibility or need some information about the process, they're welcome to call or come in, and we will give them what information we have. If there's reason to believe that they need to be tested or see a doctor, we can put them in the system to get into the VA hospital to do that.
Okay, thanks, Richard. And let's shift over to Alette Wright. And Alette, why don't you just tell us about yourself and your work in the community here?
Okay, I'd like to, thanks. One hat I wear is as the education coordinator at Planned Parenthood. And in that role, I have a lot of opportunity to do education in the community, especially with the under 24 population, which I think is a crucial population to reach with information about this epidemic. We're seeing numbers rise in that population across our country, especially in females, for a couple of reasons. So prevention is really the name of the game as far as I'm concerned. It's one thing I feel very strongly about, and I'm glad I have the opportunity to do as much education as I do. I'm also affiliated with a couple of projects that are directly serving HIV-infected clients, and also I co-facilitate the support group in town, or have done so, and also provide pre- and post-HIV test counseling at the health department as a volunteer. So have contact across a variety of focuses with members of the community, both in prevention and education, and in trying to link members of the infected population up with services.
Mm-hmm. And what do you think, where are young people in western Montana fitting into this? I mean, you touched on that briefly,
Yeah.
under 24. What are you seeing, or what are your concerns? And I would call attention to the most recent article that I saw in the New York Times, which it says, study finds many heterosexuals are ignoring serious risks of AIDS.
Well, I think that's true in all age groups of heterosexuals, from my experience, that people have a perception of themselves as not being at risk if they're not injecting drugs or having homosexual encounters. But we also have in Montana what I call, or what a couple of the young people that I work with call, the I live in Montana syndrome, which is, I live in Montana, it's not going to happen to me. I don't inject drugs, and young men aren't having sex with other young men. So they don't perceive themselves to be at risk, and that's a real concern for me, because certainly they are and can be if they're choosing to have unprotected sex.
Okay, good. Let's move on. Dr. George Reese, infectious disease specialist here in Missoula. George, what are you finding in your professional life here?
Well, I moved
Excuse
here.
me, are we doing on sound okay, and everybody in the audience can hear us all right? Thank you. Sorry, George.
That's quite all right. Well, I moved here from New Orleans in June of 1990, which, as you can imagine, is an area where there's much more HIV infection and AIDS than we have here in the state. And came here to bring infectious disease expertise to this area, and have focused most of my efforts to this point on educating physicians and other healthcare workers regarding treatment of HIV disease, as well as the means of transmission and how to prevent transmission within the hospital setting. There's a tremendous amount of work that has to be done and is being done across the state in regards to bringing people up to speed in their knowledge base regarding transmission within the hospital setting. Specifically, that it's not very transmissible at all. And as long as there are guidelines followed, the virus can be avoided almost completely, virtually completely. But my reasons for coming here tonight are because I feel a very important need to speak to the community at large about the very important issue of prevention of transmission. As my two previous panelists have mentioned, there's a tremendous amount of denial about the degree of risk that people are subjecting themselves to. And that denial is partly because people feel that there's a brick wall built around the whole state of Montana, and that AIDS and other kinds of infectious diseases just won't affect them as long as they're living here. And clearly that is not the case. And I have in my own practice persons who have become infected with HIV from a variety of routes, but certainly some of the less common routes currently in the United States, such as heterosexual intercourse. And I think that that's a very important issue, and there is going to be an increased number of those kinds of cases as the result of people either being promiscuous or not taking responsibility for their actions, specifically the use of condoms and knowledge of how to use condoms properly, which can dramatically reduce the incidence of transmission, not only of HIV, but also of a variety of other agents of sexually transmitted disease.
I usually have to inject a personal note, but language and communication and embarrassment things. I was in a fast food shop a couple weeks ago, and I was looking for some condoms. Well, there was a woman on duty behind the counter, and I almost walked out because I did not want, I was a little bit embarrassed. And finally I said, well, wait a minute, why are you doing this to yourself? And finally I just said, can you tell me, do you people sell prophylactics? I said, I'm looking for some graceful word. And she at first herself responded with a certain degree of embarrassment, and then we both caught ourselves and looked at one another, and she said, yes, I think they're, right down there, and then she got specific, next to the aspirin or something like that. And then I turned around and I said, well, I guess we're all learning to talk again, aren't we? And she said, yeah, we are. And so even, I'm not known as a person with a lack of assertiveness, but if I have a hard time, asking for something, if I have to take that leap, then what happens to a teenager or what have you, or that same old thing. So anyway.
Well, I think that's a very important issue because sex in general is something that we as an American society have a great deal of difficulty talking about. And then to add to that the going into a drugstore and talking to a total stranger, and especially if you're a teen, it's bound to be somebody who is older than you, and asking them where can you buy, and whatever word you want to use, condom, prophylactic, rubber, or any of the other myriad terms that are used, they're all terms that are bound to make you blush unless you are used to talking about it. And the only way to break down those barriers is to raise consciousness. We used to not be able to say things like syphilis and gonorrhea and herpes. We couldn't even mention those words. And now, as the result of increased awareness, we can talk about those diseases and recognize that through the open dialogue that people have, that eventually we will get to the point where we are able to go into a drugstore and ask for condoms and not blush.
I'll throw this at everybody, but particularly at the medical professional. I've often thought, well, why don't pharmacies themselves and the pharmaceutical industry in Montana and elsewhere take a lot, put up big signs saying, condoms right over here, the way, just the way it's like potato chips, that is part of the process of communicating and saying we've got to, they're making money off of it, so why not announce it? And by announcing it in big bold letters, it makes it more acceptable to a customer, and it makes it more ordinary.
I think we as a culture have limited that. I think that our reluctance and difficulty in talking about sex in general, as George said, has really kind of put a censorship on that kind of availability of information. There's another issue that we deal with as a state with a great number of rural areas, and that's if you're a teen in a very small town, your family knows the pharmacist in town, and you need condoms, you'd probably die before you'd go in there and purchase a condom. So just the availability and the fact that we do, as a culture, have so many taboos around talking about intercourse, it's easier for us to have sex than it is to talk about it. And that's definitely one of the barriers we have to address as
What-
educators.
One of the ironies I've seen in talking with high school kids is my sense is that they are more comfortable in talking about condoms than we are
Mhm.
as adults,
Mhm.
and yet are more cavalier about using them.
Right.
Hmm.
I think you're right with that. My perception is that as well.
I guess I'd like to interject to the
Yeah.
audience, and that this discussion should not in any way be interpreted as promotion of sexual relations between people, because clearly all sexually transmitted diseases can be transmitted by having sexual relations, and we used to talk about safe sex, but we now talk about safer sex. Because even though you can dramatically and almost totally eliminate the chance of pregnancy as well as transmission of diseases by the use of condoms, there still is a very, very small chance of transmission, such that true abstinence or being involved in a monogamous relationship certainly is better. However, recognition of what people do in real life, and that's what all three of us, I think, probably deal with a lot.
Right.
Is it would be nice to deal in a society where people really were not sexually active at all, but in the situation where people do make informed choices. Some people are indeed going to decide to have sexual relations, and in those situations, it's important to know where to find condoms and how to use them appropriately. And the statistics that you'll see quoted by certain groups about the failure of condoms, et cetera, virtually all of those failures are because people don't know how to use them correctly.
Mhm.
And if you are taught how to put one on, et cetera, then the chances of transmission of HIV, the chances of pregnancy, et cetera, are dramatically reduced.
I saw Linda Ellerby on Magic Johnson Talks to Kids, and she demonstrated the use of a condom just using her fingers. We happen to have, and maybe Alette could explain
Here, I can
all
grab
right,
this one.
what the background is on this package and what's being done with it.
Okay, great. Well, these are Montana survival kits. We're now putting out survival kits that say choices. These are aimed, it's a little sort of a prevention packet that's aimed at, well, say the under 24 or under 20 group, and it addresses, it says on the back, it says get a life, and it's a threefold message in these. And when I was doing an internship at the health department several years ago, we were getting together and saying, there's three things that if we can encourage young people to do, we could save a lot of lives. And one of them is to wear their seatbelts. So we have in this box a little sticker that says get a life, buckle up, that can go in a car. If we can encourage them not to drink and drive, we have a card that has a lot of information about drinking and driving on it. And if we can encourage them to use a condom when they're having sex. So we packaged this little packet of things together with all of this information. These also have, there should be a button in here that says designated driver. So there's a designated driver button. We also have 2 condoms in here. And with information, as George was saying, on the back of one of these cards on how to correctly use a condom. We've had a fair amount of response from this, and we were able to distribute some of these to young people last year. And it was quite successful. They're a nice little gimmick. People are drawn to them. And they do get that message across. I mean, it's the information, the printed matter in these boxes is what's really powerful, I think. And this has evolved through the years. So it's one of the tactics that we've taken to try to get the attention of that younger age group. And it also, there's some very compelling reasons for people to abstain from sex. But we also know through some studies that have been done on high school students in Missoula that about 60% of those who are graduating from high school have had intercourse. That means 40% have not. But so we need to address the fact that it's going on.
So where can you get a survival kit?
Health Department, Missoula City County Health Department is the distributor of those.
Right.
And those are free?
Those are free.
Well, Are they free?
Well, what the health department has done is support the distribution of these in a variety of settings at
Right.
no cost to those in the community. Some other communities have chosen to purchase a
Right.
number of them for their own distribution.
Okay, well, I'd like to put in a plug for the vet center, because the vet center acquired, I believe, a total of 60 or 80 packets of these. Half of them are aimed at the younger set of people, the younger generation, and the other half are what's called the adult survival kit. And many of those will be available through the vet center for clients that pass through. But if someone would like a few to see what they're about, and I'm sure that they could call the vet center and maybe pick up a couple, but we're kind of primarily holding on to probably most of these for the vets and significant others and families. But we do have a stack that the vet center acquired from the county health department, and they're very imaginative, and a lot of imaginative language in there. And I want to say that the vet center also, which, by the way, the videotape, like any other patient, which ran just before our discussion here tonight, is one of the videotapes that the vet center has. They have about 6 or 7 different tapes. One about AIDS and IV drug use, other about hospice care of AIDS patients, changing the rules, which is going to be running next week. But they also, the vet center acquired 4 copies of Magic Johnson Talks to Kids, which is a video, and which he did with Linda Ellerby, and an age group really from about 9 to 13. And it's I was impressed that it was soft-spoken, and it made the effort really on that tape is to be able to talk to that age group and say it's real. And he had a couple of the young kids who were HIV positive, either through transfusions or what have you. But those tapes are also available for loan to the community from the vet center. And we will be showing that Magic Johnson Talks to Kids videotape on World AIDS Day, the 1st of December, Tuesday, when we'll be back in the studio airing that tape and having another panel discussion. And one more thing that the vet center did in its commitment to the community is purchased 20 copies of Magic Johnson's book, What You Can Do to Avoid AIDS. The vet center has ordered these through the Missoula Public Library. They haven't yet arrived yet, but they'll be available through the library and through schools. We'll do a redistribution. So they'll be at the library soon, and this is a very plain-spoken book with a number of diverse essays by specialists from around the country. It's not all written by Magic. But a very plain-spoken and direct communication about how to save your own life, and he should know at this point. And if it's all right with you folks, we'll declare the phone lines are now open. We'll continue with our discussions here. And you want to call 542-MCAT, M-C-A-T, 542-MCAT, with a question for any of our guests, Richard Johnson of the Vet Center, Alette Wright, Planned Parenthood, Missoula AIDS Council, County Health Department volunteer on AIDS information, and Dr. George Reese, infectious disease specialist. Would you be able to demonstrate?
The proper application of a condom?
Yeah.
I'd need a volunteer finger. Great. Thank you.
All right.
Well, I think that the first thing to emphasize to people is that a condom should be placed before there's any genital contact at all between two people. People think that it only has to be put on before you actually have penetration. And indeed, a lot of transmission can occur, and I'm talking more about syphilis and gonorrhea and herpes than I am about AIDS, but certainly HIV infection as well can be transmitted just by the touching of the genitals between two consenting individuals. So that's the first thing, is to put the condom on before you have any genital contact between your two people. And the condom, this is one that has a small amount of lubrication on it, but not a whole lot. But it's important that you can see that it will unroll on. Are you close up to this? Don't put it on such that you have. Well, it has to be put on such that it can unroll. Now, the next very important issue to be aware of is that there is a little tip at the very end, which is designed as a reservoir for the semen after ejaculation. And it's important to not pull the condom so tight that there's no space for the semen after ejaculation. If that happens, then the condom very well may break, and then the spillage of all the contents out into the partner. So leaving enough of a space to hold the semen, and usually just a little tip like that is probably adequate. And then the condom needs to be completely unrolled all the way down the shaft of the penis, and obviously these fingers are not as long as most penises, but I will just get this completely unrolled such that you can see that at the very bottom, you can easily tell when you've completely unrolled it. This is a big condom. All right, so then the condom is used, and it's also very important to then withdraw the penis before you become soft, because once you become soft, then the condom no longer adheres to the contours of the penis, and the contents would then be able to spill out from the bottom and then cause infection.
Mm-hmm.
So withdrawal before one goes soft is the next very important part of this. And I guess finally I should mention that condoms can be weakened by the use of any petroleum-based lubricant.
Mm-hmm.
KY jelly is okay, but Vaseline is not.
Mm-hmm.
And there are a variety of different lubricants, and most of them that are safe for condom use will say so on the label.
Mm-hmm.
But anything that has a petroleum or oil base to it, mineral oil, for instance, and Vaseline are the ones that people use most commonly inappropriately. And I would just recommend the use of KY jelly
Mm-hmm.
For lubrication.
What's the noni-noxol that gets promoted as being as if it were an add-on safety measure or something?
Monoxanol 9 is a spermicide that many condoms have within them. It's also a lubricant. It's very slippery feeling. I think that condom probably has it on.
I think so too.
And it has been shown to inactivate HIV.
Okay.
And so many condoms that are marketed do contain that additional protection.
Mm-hmm. We're still waiting any calls out there with any questions. It's 542-MCAT. It's live tonight in Saving Lives, the battle here at home, a series of videotapes and panel discussions sponsored by the Vet Center of Missoula. And our guests, if you've tuned in late, are Richard Johnson of the Vet Center, its director and a counselor there, Alette Wright, who works at Planned Parenthood and is a volunteer with the county health department on AIDS issues, and Dr. George Risi, an infectious diseases specialist. I had some other, I wanted to some other figures that I had that in Montana, I think we have a call. The state laboratory has confirmed 368 HIV positive tests since 1985. And the surveys indicate that this figure of 368 HIV positive tests at the state lab would be approximately 50% of the total HIV positives in Montana, with other tests being in private doctor's offices and other centers. And we got a call on line one. You're on the air.
Hi.
Hey, go ahead.
I saw a headline today about the state of Montana reducing the amount, or planning on cutting back on Medicaid. And I guess my question is two-part. One is, what do the panelists of reduction in Medicaid and the impacts on health care in regards to AIDS, and also what do they see the state government's commitment to this health issue being?
All right, hang in there, and we'll try and see what we got here.
I can address the
Yeah.
state commitment a little bit. I'm not real clear on the other Medicaid stuff for sure, but there are some monies, well, they're Ryan White monies actually. It was a federal allotment that is administered by the state to the local agencies that provides a certain amount for each HIV positive client or person with AIDS. That is one source of funds. It's not a huge amount. Whether or not we will be continuing to receive those funds, I don't know. As far as how the Medicaid cuts are going to affect HIV clients, I really don't know.
I don't think that's been determined yet. It'll be determined by the new cabinet and president and Congress during this next year. I think Clinton has made it fairly clear that he is dedicated to fighting AIDS and providing what monies are necessary, but I think it's also clear that a lot of programs are going to be trimmed.
Mm-hmm. Yeah, many of those decisions about Medicaid funding are made at a state level, and I hope that the new governor and the new administration do recognize the need for funding in this area. But I think that in direct response to the caller's question, that is it's too soon to know, and we just need to expect that there are going to be some cuts, and hopefully they won't be in the areas that we all deem to be the most important.
Mm-hmm. It's 542 MCAT, and we're live on the air, and we're waiting for your calls. Well, what is there more, even if that means in an affirmative way, what I'm talking about programmatically or, for want of a better word, spiritually or politically, should the state, the people of the state of Montana be doing? I mean, we've touched on a number of areas. I mean, are we lacking anything? Does TV and radio need to do still more? Should TV be advertising condoms?
Yeah, I think that we while we're talking about the number of patients with HIV infection and AIDS in the state, we should recognize with a certain degree of gratitude that we do have breathing space compared to other areas of the country that are much more hard hit by this epidemic at this point. And I don't think that we have the time, though, to sit back and rest on our laurels about that. If we can prevent what's happened in other parts of the country from happening here, then this is to the better of all citizens in the state. So I think that we need to be much more proactive than we have been regarding disease transmission and the prevention of disease transmission. That's the one hand. The other hand is to recognize how AIDS is not transmitted. So people who have HIV infection should not feel that they are treated like pariahs, like lepers, because there is no chance of transmission of the virus by any kind of casual contact, even by relatively intimate contact, such as embracing, kissing on the lips, etc., poses no risk of transmission of HIV. So if we can get those dual messages out, that yes, we are lucky to be in a low incident state, but we need to continue that by prevention of the transmission of disease, by talking about condoms, by talking about sexually transmitted diseases, by divorcing that from the whole issues of the morality of whether this is right or wrong, recognizing that that's a startling statistic that 60% of high school graduates in Missoula have had sexual experience already, and virtually all of that is unprotected.
That's
I'm
right.
willing to bet.
That's right.
So heightened awareness is what we owe to the community, and I think that it's incumbent on television, on radio, on newspapers, on anybody who has access to the public to behave in a responsible manner and help prevent the transmission of disease.
And I would add to that by saying that those of us who are educators need to be very concerned about what is being taught in the schools, whether some teachers are comfortable talking about sex and sexuality and sexually transmitted diseases, and some are not. I do have the opportunity to do a lot of in-school education. I talk to a lot of church groups, a lot of clubs, and that's a great opportunity, but it's got to be happening with some consistency. There are some folks who feel that it needs to be mandated at the level of the Office of Public Instruction, and then somehow evaluated and followed up with that we know that people are getting sexuality education in school, prevention education, information about how this virus and other sexually transmitted diseases are transmitted. So I just feel like education is really an area that we have to support as a state and as a local community.
Well, well, how do you think, let's say, the schools in Missoula are doing? I mean, in other words, and not, maybe obviously you're not in touch with every school in every situation, but do you have an impression of how things are going?
I do have an impression, and I think Missoula schools are, for the most part, doing a good job. I teach all the freshman health classes at 2 of the high schools, and a variety of other classes at all the other schools. So the high schools are aware and are making a serious attempt to provide that education for people. The one problem.
Excuse me, I just want you teach freshmen, both men and women,
right,
freshmen.
Correct.
At all 3 of the high schools?
2 of the high schools I do.
Schools.
Big Sky and Hellgate, and teachers at Sentinel do a fair amount of their own education there.
Now, is this the kind of book that you could, I mean, I'm not foisting this on you, but is this the kind
Sure.
of book that you could bring in and say, I'd like you to do a book report on this, or pass it along, or what?
Well, more, the format that I tend to have is access to two periods for each class, where I talk about sexual decision-making, contraception, sexually transmitted diseases, safer sex, and just the whole ball of wax. So it's not a lot of time. But I'm very direct with the classes that I teach, and I do talk about condoms and their proper use. I also talk about abstinence. I encourage young people to consult with adults when they're making those decisions. But I have the opportunity to be quite direct.
How are you received?
Well received, very well received by the students. Once in a while, there will be a comment from a parent who's not comfortable with the material. That's certainly understandable. But very well received by the students. I get asked a lot of questions, encourage people to be tested for sexually transmitted diseases if they have a sense that they're at risk. Particularly chlamydia and human papillomavirus, the virus that causes genital warts, are epidemic in this community. And I just try to make the point that HIV is transmitted the same way. You have friends who have had chlamydia or HPV, or if you have put yourself at risk of those diseases, you may be at risk for HIV.
Could we touch a little bit on fear of testing? Fear of testing for HIV. I was tested for the first time, sometime this year, and it took me a long time to get to that point. And then I've talked to other friends and colleagues, adults, some of whom have been celibate for many years, and were after a long period of celibacy, were contemplating or involved with a romance, or were about to be, and even though many years had gone by since they'd had any kind of a sexual relationship, there was still that trepidation of oh, geez, I wonder if something might have happened, 7, 8, 9 years ago, so do you have any?
Could I add to that comment and direct it towards George, maybe?
Yeah.
I was of the impression several years ago, maybe 5, 6 years ago, that there was a fairly tremendously high false positive rate with the earlier tests. And so there was a real fear of testing positive and still not really knowing whether you have it or not. I don't know if that's accurate. That's what I was told. And if so, I understand that has changed.
When you talk about false positive tests, you have to remember that there have always been, even since 1985 when the first test became available, there have always been supplemental tests, the so-called confirmatory tests, to make sure that a positive screening test is indeed and not a false positive test. And it also depends on which kind of a population you're talking about. If you're talking about a group of very sexually active gay men, then if they have a positive screening test, then the chances are very high that that is indeed a true positive. Whereas if you go out into the general population or you're testing donated blood for blood transfusion, the chances are much higher that a test will be a biologic false positive, and there's a variety of different reasons for people to have a false positive test. However, all tests that are found to be positive are then passed on to a confirmatory test, and the most common one that's used is called the Western blot. And the Western blot eliminates virtually all of those biologic false positives. Nobody has a falsely positive Western blot test.
Okay.
So if you have a false positive screening test, you don't even find out about that, because when you come in for your counseling, and by law, everyone who gets an AIDS test in this state has to give informed consent and has to get both pre-test and post-test counseling. So when you get your results, and they have to be face-to-face, you will not know the results of the screening test. All you'll know is whether you are truly positive or truly negative. I think that it's a very important issue to talk about the fear of testing. And one of the most insidious parts of this whole epidemic is the very long latent period, where people indeed can be completely without symptoms for 9 or 10 years. And actually the average time between becoming infected and developing AIDS is about 10 years.
Mm-hmm.
So somebody could indeed have been celibate for 7 years and still be positive and not know about it. And that's one of the worst parts about this whole epidemic is that it's spread by people who are completely healthy, who look just like you and I. However, if you are found to be infected before you get ill, there's an awful lot of intervention that can be done. And so it's clear that we can keep people healthy longer and probably make them live longer as well if we find out if they're infected.
Mm-hmm.
So there's a variety of different reasons to find out if you're infected.
Mm-hmm.
And the most important one also, in addition to your own health, is because of the transmissibility of that agent to your loved ones,
Mm-hmm.
Such that if you're HIV infected, then you need to modify your sexual practices.
Mm-hmm. Now, again, as a uninformed layperson or a less informed layperson, so someone tests negative, they do the HIV test, getting back to this latency period.
Mm-hmm.
So does that mean that they are truly, or is there still something that could be lurking back there that just has not shown up yet?
Yeah.
I get confused about
The
that.
whole issue of latency has been horribly mismanaged by the media, in my
Mm-hmm.
opinion. There are certain people, and it's a very, very small number of people, who are infected and do not show a positive test on the antibody test.
Mm-hmm.
That number is far less than 1/100% of all
Mhm.
people who are HIV infected.
Mhm.
And that has been blown way out of proportion by the media.
Mhm.
I've never seen a single patient with AIDS who does not have a positive antibody test. The vast majority of people who become infected will show a positive antibody test within a period of about 6 weeks to 3 months after becoming exposed. And so if you engage in some activity that has placed you at risk and have a negative test 3 months later, then the chances are virtually 100%. And that rises to almost completely 100% by 6 months. And so many people will get tested at 6 weeks, 3 months, and then at 6 months.
I see. So if I read you back again, someone tests negative, right? But say 3 months before they took that test, they may have been sexually active with a person or whatever the situation. In other words, and that at that point, if they had picked up the virus, they may be testing negative 3 months later, Because
The chances of them testing negatives 3 months after that activity are virtually zero.
I see. Okay. All right.
I think it's important to remember that even the riskiest of high-risk
Mhm.
behavior is not 100%. Even if you get a blood transfusion,
Mhm.
a whole unit of blood from an AIDS patient,
Mhm.
the chances of getting infected are not 100%. They're about
Mhm.
90%.
Mhm.
And most sexual activity transmits the virus very inefficiently.
Mhm.
And estimates have been in the range of 1 to 100 to 1 in 500 sexual encounters between a positive and a negative person are able to transmit the virus. But it's Russian roulette because there's no question, and I've had people in my own practice who have had one sexual experience and have become infected with AIDS.
Yeah.
So there's no question that it happens, but if
Mhm.
you're an odds maker, the chances are small
Mhm.
per individual encounter.
What,
Go ahead.
if I may ask, what can you tell us about the new information we're hearing, at least in the media, on a new strain that is not testing out the same way the
There was
strain is, if you will?
a great deal of concern raised as the result of the last International AIDS Conference that was held in Amsterdam, where a variety of different investigators got up from around the world and said, we have patients who have clinical AIDS who test negative by all the most sophisticated
Right.
methods that we have for testing, and we cannot detect HIV in them. And they pooled all their data and came up with about 20 or 25 patients who fall into this category. And the jury is still out about what's going on in that situation. But many of these people did not fall into any recognized risk groups, and I think that part of some of these people probably have immune deficiencies that we have always seen. I mean, AIDS came around in around 1980 or 81, but going back even into the 18th and 19th century, we have people who died of AIDS-defining illnesses. Because there's vagaries within the body's immune system. Sometimes the immune system just plays out for reasons that are totally unrelated to HIV. So some of these people are going to end up having that kind of a phenomenon where we're just keyed into looking for AIDS because of the situation in America in the 90s. There may be some people who have some kind of a viral infection, but it does not appear to be very readily transmissible, and I don't think that there's enough evidence to speculate, and certainly no reason for the public to get concerned about this until we know more.
I think all of us would agree that while we certainly hope that AIDS research is funded sufficiently in the next couple of years and that they make progress on that, we in Montana can and need to stop AIDS, the spread of AIDS in this state through education and safe practices.
I like what I read about, I think it was North Dakota, about 3 or 4 years ago, says our goal is 0. And
Right.
and I think it is important to not just to say it, but then to actually move, day in and day out and say, well, we're just going to do it and educate and talk about it and, until we start at least moving in that direction. I think you people are so informative that nobody's calling up because they're just riveted to their screens. But anyway, we're still on the air, and it's 542-MCAT if you want to give us a call with a question. We're standing by live. I have another question, unless somebody wants to jump in here. George, maybe we'll lean on you first, or whoever wants to jump in. I noticed that the Missoula County Health Department is supporting a change in the Montana sexual conduct law for reasons of public health. Are you familiar with what's going on in that area? And
I have some familiarity with it, but I think probably for the audience, you might want to just.
Well, as it stands now, Montana has what's called popularly called the deviant sexual conduct law, which forbids sexual relationships between two persons of the same gender, and also prohibits bestiality, sex with animals. And for many reasons, many people want to change that law so as to permit the sexual relationships between consenting adults of the same sex. So there is a campaign on to change that law, but I wanted to focus on the health issue with the health department, not only here, but I think in one other county at least, who are saying this is important because for reasons of public health. So perhaps, Alette, you look like you're ready to explain that a little bit.
I'd love
What,
to.
why is that?
Well, as defined by our Sexual Deviancy Act, sexual contact, homosexual behavior between two consenting adults is a felony, okay?
Mhm.
And certainly if we look at the fact that the majority of our cases of infection in this state at this time are still among gay and bisexual males, men who have sex with other men, it may be difficult to go to one's physician and define themselves as a felon and say, I may be at risk for HIV and I'd like an HIV test. I feel like that's an issue.
Mhm.
It may be a barrier for
Mhm.
individuals to be tested who are at risk.
Mhm.
In Montana, we do have a number of anonymous testing sites. We have one at the health department. Here in Missoula, we have one at Planned Parenthood, where individuals can get an anonymous HIV test where they do not have to reveal their identity. They give a couple of initials, any initials they want, and they're given a numerical identifier.
Mhm.
And they're tested anonymously, and that is one way to get around that issue. And
You mean that fear of
Mhm,
exposure?
absolutely, of
Mhm.
exposure. And we do a number, we do a lot of HIV tests, both
Mhm.
at Planned Parenthood and at Missoula City County Health Department.
So if I'm getting you in my own readings of this, some public health officials are saying, if that law is changed, more people would, since they are now within the bounds of the law in terms of their sexual conduct, would feel then okay about saying, well, now I'm going up and having my test, or
Yeah.
and because I don't have to worry about being branded as a bad person or a felon or a lawbreaker. Is that?
That's the line of reasoning,
Mhm.
yeah, certainly. I need to point out too that that law is enforced very selectively in
Mhm.
this state. It's enforced in the penal system, it's enforced perhaps in a child custody case or something like that. So, but the fact that it is there to be wielded as a weapon if the occasion arises, I
Mhm.
think is a deterrent
Mhm.
to some important public health education
Well,
matters.
it's a very old law, as I
Yeah,
understand
it
as
is.
well.
It
Isn't
certainly is.
Are we, if not the only state in the union, or certainly one of
We're
only
one
the
of very few.
who has this kind of a law which promulgates the concept that you can actually legislate morality,
Right.
that you can actually control people's behavior by making certain acts illegal. And that is a concept that we should have learned better about during the Prohibition.
Right.
And it just strikes me as an antiquated approach. And if we're going to bring Montana into the 20th century, which we arguably are not in certain regards, this is certainly one of the areas. We have to be forward-thinking and recognition that people are going to do what they want to do, whether it's legal or not,
Mhm.
if there's two consenting adults.
Mhm.
And then to wield this horrible sword over their heads in a very selective manner is just a horribly pejorative thing to do.
Mhm.
But I agree that making it legal would indeed encourage people to come in for HIV testing when they might not otherwise do so.
Mhm. And perhaps you could tell us a little bit about when we talk about counseling before you take your test and counseling after you take your test. Could you tell
Sure.
what that amounts to, really?
Sure. It's several steps. We try to do a risk assessment with an individual, find out what they may have done to put themselves at risk and when.
Mhm.
We're talking about that window period that it takes the body time to make antibodies to the virus.
Mhm.
We talk a lot about the virus itself, talk about the latent period of the disease. We talk about a lot about transmission.
Mhm.
And we do a lot of safer sex education. If a person is an injection drug user, which we haven't really touched on tonight, but as you mentioned in the opening, there is a
Yeah, we have
a group of injection drug users in our state. And if that's a risk factor for a person, we try to look at that with them and look at some ways they can reduce their risk by cleaning their hypodermic syringes or teaching them to do that. So we do everything we can in that 45 minutes that we have to do education. We talk about the test itself. We talk about the fact that we do a screening test and then a confirmatory test if we have a positive, and that it takes 2 weeks for those results to come back. A person must come back in person. These are the anonymous testing sessions. Physicians' offices may do it somewhat differently. And then we draw that individual's blood and send it off to the state lab. And then that individual comes back in 2 weeks and gets their results. That's a pretty good system, actually.
Right. Anything to add to that one, George?
No, that's wonderful, because I'm not very much involved in the actual counseling, and I'm glad to hear that it's done so well.
I feel like we have a real good system in place at both facilities.
And as Richard Johnson indicated early in the program, that the VA has been in the forefront of both certainly in many parts of AIDS research and in patient care. And again, I think it's kind of a little public lesson that if people say, well, veterans, what are veterans doing in the hospital with AIDS? American veterans, and yet they represent a large proportion of AIDS. And I'm being waved a sign saying wrap it up, but I just wanted to conclude with that thumbs up for the VA, which has been a great benefit to me in my lifetime, and for reasons of good health and helping me out. And and thanks to the Vet Center in Missoula for sponsoring this series. We'll be back next Tuesday night with a videotape program which starts at 8:30 called Changing the Rules. And then we won't have a call-in show that night next Tuesday, but the week after, which is the 1st of December, we will have another program, Magic Johnson Talks to Kids, which is aimed at the, that younger age group. It's a very comforting tape and good for kids. And that will be followed by a live panel discussion. And this has been Saving Lives, the battle here at home. And 3 of the people who are helping to save lives and participating in the battle here at home in Missoula are Richard Johnson of the Vet Center in Missoula, sponsor of the series, Alette Wright, Planned Parenthood and the AIDS Council, and Dr. George Reese, infectious disease specialist here in the community of Missoula. So thank you all very much, and I've learned something.
Thank you,
Yeah,
McCarthy.
thanks a lot. Good night. Isn't this where the credits come up and then everybody starts shaking hands and saying da 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 da?